Have you ever wondered about the methods involved in traditional biopsy testing? It's a fascinating, albeit often daunting, process that has been the cornerstone of disease diagnosis for years. But what makes it so daunting? Let's delve into that. At its core, traditional biopsy is an invasive procedure. It involves the surgical removal of tissue from the body to examine it for disease. Picture this: a patient lying on a surgical table under local or general anesthesia, while a surgeon makes an incision and extracts a piece of tissue. It's not exactly a walk in the park, is it? The tissue is then sent to a laboratory where pathologists scrutinize it under a microscope, looking for any signs of disease. This process, while immensely valuable in diagnosing conditions like cancer, can be quite painful for the patient. Moreover, like any surgical procedure, it carries a risk. There's the potential for infection, bleeding, and other complications that could arise during or after the procedure. And let's not forget about the recovery time. Depending on the location and extent of the biopsy, a patient may require hospitalization and a significant period of rest to recuperate. This could mean time away from work, family, and normal day-to-day activities. There's also the emotional toll to consider. Waiting for biopsy results can be an anxious time filled with uncertainty and fear. The invasive nature of the procedure, the physical discomfort, the potential risks, and the waiting, all these factors can add up to a stressful experience for the patient. Now, don't get me wrong. Traditional biopsy methods have been instrumental in diagnosing and treating a myriad of diseases over the years. They have saved countless lives and will continue to do so. But their invasive nature and the associated risks and recovery time leave room for improvement. These complexities and limitations of traditional biopsy have led to the development of a new approach: liquid biopsy. So, what exactly is a liquid biopsy? Now, that's a question that's been on the minds of many. Well, let me enlighten you. A liquid biopsy, in essence, is a non-invasive test designed to detect cancerous cells or fragments of DNA from cancer cells in the blood. It's a bit like a detective sifting through the bloodstream to find traces of the culprit, in this case the cancer cells. But how does it do this? It's all in the blood, quite literally. You see, as cancer cells grow and multiply, they shed tiny fragments into the bloodstream. These fragments, known as circulating tumor cells or circulating tumor DNA, are what the liquid biopsy is looking for. Imagine this: each drop of blood in your body is like a mini data center holding a wealth of information about your health. It's amazing, isn't it? And it's this trove of information that the liquid biopsy taps into. With just a simple blood test, it can reveal so much about the state of a person's health. Now, you might be wondering, why go through all this trouble? Why not just stick with the traditional biopsy methods? Well, that's where the beauty of liquid biopsy comes in. It's non-invasive, meaning it doesn't involve any surgical procedures. This not only makes it less painful and more comfortable for the patient, but it also reduces the risk of complications that can arise from surgical procedures. Moreover, a liquid biopsy can be performed multiple times, allowing doctors to monitor the progress of the disease and adjust treatment plans as necessary. This means that it can provide real-time information about the state of the disease, which can be crucial in determining the most effective treatment plan. So in a nutshell, a liquid biopsy is a simple, painless blood test that can detect cancerous cells or DNA fragments from cancer cells in the blood, providing a wealth of information about a person's health. Now that we know what a liquid biopsy is, let's delve into how it works. Liquid biopsy is a revolutionary technology, but how does it extract such valuable information from a simple blood sample? Let's dive into the fascinating world of liquid biopsy to understand this cutting-edge procedure. Liquid biopsy, in its essence, is a non-invasive method of detecting cancer by analyzing a sample of blood. It takes advantage of the fact that cancer cells, or fragments of their DNA, known as circulating tumor DNA or ctDNA, often find their way into the bloodstream. This occurrence is what makes it possible to detect the presence of cancer without resorting to invasive procedures. So, how does this process work, you might ask? Well, it all starts with a simple blood draw, similar to what you'd experience during a routine checkup. This blood sample then embarks on an enlightening journey through the world of molecular diagnostics. Once the blood sample is collected, it's whisked off to a lab where the real magic happens. Here, scientists use advanced technologies to isolate and analyze the ctDNA. This ctDNA is like a molecular fingerprint, providing a unique signature of the cancer, if it's present. The next step is the extraction of plasma from the blood sample. Plasma is the clear, straw-colored liquid portion of blood that remains after red and white blood cells and platelets are removed. This plasma is where the ctDNA resides. Once the plasma is separated, it undergoes a process called DNA sequencing. This is where things get really intriguing. DNA sequencing is a technique used to read the sequence of DNA bases, adenine, guanine, cytosine, and thymine, in a particular sample. By reading this sequence, scientists can identify specific mutations or changes in the DNA that may indicate the presence of cancer. It's important to note that not all mutations indicate cancer. Our DNA changes throughout our lives due to various factors, including exposure to environmental toxins and natural aging. However, certain mutations are known to be associated with specific types of cancer. When these mutations are detected, it can provide a strong indication that cancer is present. The beauty of liquid biopsy is that it can also help identify the type of cancer, its location, and even how it's likely to respond to different treatments. This is because different cancers have different DNA mutations, and these mutations can provide clues about the nature of the cancer. In addition, liquid biopsy can also track changes in cancer over time, offering a dynamic picture of the disease as it evolves. This can be invaluable in monitoring the effectiveness of treatment and making necessary adjustments. In conclusion, liquid biopsy works by using a simple blood sample to search for the DNA of cancer cells. It's a complex process that combines the simplicity of a blood draw with the power of DNA sequencing to detect and monitor cancer. It's fascinating how such a simple procedure can provide such detailed insights into a person's health, isn't it? So why should one consider choosing liquid biopsy over the traditional methods? This question brings us to the heart of our discussion today: the key advantages of liquid biopsy. Firstly, liquid biopsy is non-invasive. Unlike traditional biopsy methods which often require surgery or needle insertion to extract tissue samples, liquid biopsy simply involves a blood draw. This makes it a much less painful and stressful procedure for patients. In fact, it's as simple as getting a regular blood test. The non-invasive nature of liquid biopsy also means it's safer. Traditional biopsies come with a risk of complications, such as infection or damage to the tissue around the biopsy site. With liquid biopsy, these risks are significantly reduced. Secondly, liquid biopsy allows for more frequent testing. Because the procedure is so simple and low risk, it can be carried out regularly, providing real-time monitoring of a patient's condition. This is particularly valuable in cancer treatment where detecting changes early can make a big difference in prognosis. Now let's talk about the comprehensive picture that liquid biopsy provides. Traditional biopsy takes a sample from one specific area, but cancer isn't always uniform. Different parts of a tumor can show different genetic mutations. Liquid biopsy, on the other hand, can detect cancer DNA from all over the body. This gives doctors a more complete understanding of the cancer's genetic makeup, which can help guide more effective treatment strategies. In addition, liquid biopsy can pick up signs of cancer that may not be visible on imaging scans yet. This can lead to earlier detection, and as we all know, early detection is key in fighting cancer. Finally, liquid biopsy is faster. The results can be available in as little as a few days, compared to 1 or 2 weeks for traditional biopsy results. This quicker turnaround time can be crucial, especially in cases where prompt treatment is necessary. Clearly, liquid biopsy offers significant advantages over traditional biopsy methods. Its non-invasive nature, the ability for more frequent testing, and its capacity to provide a comprehensive picture of the cancer make it a game changer in the field of medicine. But like any medical procedure, it's not without its limitations, which we'll delve into next. Despite its advantages, liquid biopsy is not without its limitations. Just like any emerging technology, it has its own set of challenges. One of the main limitations is the inability to pinpoint the exact location of the tumor. Traditional tissue biopsy provides a direct sample from the tumor, allowing doctors to know where the cancer is. With liquid biopsy, while we can detect cancer DNA, we can't ascertain its precise origin within the body. Another limitation is the potential for false positives. A liquid biopsy might detect circulating tumor DNA, but this doesn't always mean cancer is present. It could be from a benign tumor or other non-cancerous conditions. This means there's a risk of overdiagnosis, potentially leading to unnecessary treatments. Moreover, liquid biopsy is currently not as sensitive as traditional biopsy. It may miss a small number of cancer cells in the blood, especially in early-stage cancers, where circulating tumor DNA levels are low. This could lead to false negatives, where a patient with cancer might be incorrectly diagnosed as cancer-free. However, it's not all doom and gloom. The future of liquid biopsy is incredibly promising. Scientists are working tirelessly to improve the sensitivity and specificity of the tests. With advancements in technology and a better understanding of cancer biology, we expect liquid biopsy to become even more accurate and useful. Imagine a world where a simple blood test can not only detect but also monitor the progression of cancer, guide treatment decisions, and even predict relapse. This would revolutionize cancer diagnosis and treatment, making it less invasive and more precise. It's an exciting prospect, isn't it? While liquid biopsy has its fair share of limitations, it's important to remember it's a relatively new field. There's plenty of room for improvement and innovation, and the medical community is optimistic. We're on the cusp of a major breakthrough in cancer diagnostics. While it's not perfect, the future of liquid biopsy is promising, and it's set to revolutionize cancer diagnosis and treatment. In the end, what does this mean for medical students and professionals alike? Well, let's take a moment to recap. We've delved into the world of liquid biopsy, a cutting-edge method that is transforming the landscape of cancer diagnostics. Far from the invasive procedures of traditional biopsy, liquid biopsy is a simple blood test that offers a less painful and more convenient alternative. We've seen how it works, gently fishing for telltale signs of cancer in the bloodstream. It's a bit like searching for a needle in a haystack, but with the right tools and techniques, it's entirely possible. And it's not just about finding cancer. Liquid biopsy can also track the disease's progression and reveal how well a patient is responding to treatment. We've also highlighted the many advantages of liquid biopsy. It's less invasive, less risky, and can be done more frequently than traditional biopsy. This allows for real-time monitoring of cancer, leading to early detection and potentially better outcomes for patients. But let's not forget the limitations. Liquid biopsy is still a relatively new technology, and we're yet to fully understand its potential and pitfalls. It's not a standalone diagnostic tool yet, but rather a complement to traditional biopsy methods. The future, however, holds promise, as researchers continue to refine this technique and expand its applications. For medical students and professionals, understanding liquid biopsy is not just about keeping up with the latest trends, it's about staying on the front line of a rapidly evolving field, where new technologies are continually redefining the boundaries of what's possible. As we navigate the complex terrain of cancer diagnosis and treatment, liquid biopsy stands as a beacon of progress. It's a testament to how far we've come, and a glimpse into the future of what might be. So, as we continue to advance in medical technology, one thing is certain: liquid biopsy is a game changer.